Okay, so good morning, everyone. My name is Dominique Samuels, and my partner is Alejandra. Today, we'll be talking about asthma. As we all know, asthma is a very, very common disease. Asthma usually happens during early childhood, and it can happen during your adulthood, but it is very rare. Okay, so on our next slide, we're talking about asthma. What is asthma? Let's get a little bit in depth on this one. So, asthma is a respiratory disorder, also defined as chronic inflammatory disease of the airways, that involves periodic episodes of bronchial obstruction resulting in difficulty breathing. So, basically, what this is saying that asthma is a chronic inflammatory respiratory disease. And what that means is that basically your airways are inflamed. And when something's inflamed, there's swelling, there's redness, and there's a minor pain there too. So, asthma, it can affect people of any age, but often starts in childhood. Asthma is a disease which can change throughout a person's life throughout the year from day to day. So, many people you'll hear, they'll say something like, I used to have asthma, which means that it's not something that you can always have. Yes, it is possible that your asthma can come back due to something that can give you that attack, but it can change. It is characterized by attacks of breathlessness and wheezing, with a severity of frequency of attacks varying from person to person. These attacks are associated with variable airflow obstruction and inflammation within the lungs. So that's why it is so hard to breathe because your airway is obstructed. When your airway is obstructed, when it's blocked, you cannot breathe properly. So, therefore, this is a life threatening disease. So, for our next slide, we're talking about what causes asthma. We know that asthma is something that is very life threatening. um it can basically is something that can obstruct your airways. So we want to know what causes asthma. What causes this airway obstruction? So if you have a family history of hay fever, a history of asthma, respiratory infections, sedentary lifestyle, children remaining indoors, or even poor ventilation, many people might say something like, oh, I'm allergic to pollen, I'm allergic to dust, spores. So things like that, we can see that asthma is an airborne disease. So any airborne substances such as pollen, dust mites, and mold spores, those things can trigger an asthma attack. But that's not for anybody. That's not for everybody. That varies from person to person. So I can be allergic to pollen, but John can be allergic to, let's say, dust mites. Those trigger different things. Okay, so here we're looking at the disease process of asthma. We do know that the disease process is basically the same thing as the pathophysiology of asthma, which means like how it happens, how it came about. So we know that during an asthma attack, the size of the airway and the lungs, they swell and the airway shrink, which causes a person to have difficulty breathing. That's why it's harder to breathe. So we see here that number one, inflammation of the mucosa with edema. Number two, contractions of smooth muscle. Number three, increased secretion of thick mucus in the passages. So let's get a little bit more in depth. So what does it mean by inflammation of the mucosa with edema? So when it comes to asthma and edema, um, basically the reduced pumping um, is like reduced on the left side of the heart, I believe, which leads to the buildup in the lungs. So once there's like a reduced pumping, it's not pumping enough, their fluid buildup becomes very prominent, which is what causes breathlessness and wheezing and cardiac asthma. Number two speaks about the contraction of smooth muscle. That's pretty self explanatory. Basically, the bronchial smooth muscle contracts, which induces airway narrowing. And that's why it's so hard to breathe because the airways are narrowing. Number three, increase secretion of thick mucus in the passage. I'm so sorry, y'all. In the passages. So during increased mucus production in asthma, um, the reaction of the lungs is constantly irritating. So usually this can happen during like cigarette smoking or air pollution. It's just an increase of mucus and all those salivas in your airway. So, and it's not like it's any normal regular asthma. No, this asthma is polluted, which is composed of many dead cells and debris. And when that gets into your airway, not only is it hard to breathe, but it's contamination. So that's what causes the contraction and the thickening of the lungs. Okay, types of asthma. You have extrinsic asthma and intrinsic asthma. When you hear extrinsic, you're thinking of external. So, extrinsic asthma is symptoms that are triggered by allergens such as dust mites, pollen, mold. It's basically when the immune system overreacts to producing too much of a substance throughout the body. So, those are things that can trigger an asthma attack, but an extrinsic asthma attack. For an intrinsic asthma attack, that's when the airway becomes more and more narrow, resulting from something such as stress, which is a non allergy related factor. So, usually, when other people say that they have an asthma attack, it's for something extrinsic, outside, outer in the atmosphere, such as pollen, dust mites. But intrinsic is something on the inside. So, too much stress, um, those that is a factor that can cause an intrinsic asthma attack. That isn't as common as the extrinsic one, but it is possible. Okay, so what to expect? Symptoms of asthma. So there's some symptoms such as coughing, inability to walk, wheezing, rapid and labor breathing, tachycardia, and eventually hypoxia. So for our next slide, we're just gonna define what each of these are. So coughing. Coughing is accompanied by tightness and feeling chest, and as the attack progresses, it develops agitation. So once you keep coughing, you're basically just coughing and just trying to get some type of, airway so you can breathe properly. The next one is inability to walk. This condition results from the excessive fatigue caused by the insufficient blood supply at the moment. So once your lungs is basically becoming contracted, it's hard to breathe, which makes it hard to walk as well. Wheezing, sound produced as the air passes through the narrowed bronchioles. So it's going to be wheezing that's taking place because not all the full air is not getting through, which causes wheezing to occur. Rapid and labored respirations, use of accessory muscles and chest contractions. Tachycardia results from the anxiety caused by breathing difficulty. So that anxiety that you have, you're like, and all that hyperventilation that's occurring causes your heart to start to pump even harder and more rapid. And hypoxia, deprivation of adequate oxygen supply at the tissue level. Hypoxia is basically low oxygen supply. So automatically we know that with asthma, since your airway is tightening, you're not getting enough oxygen, so that supply is low. And that is also what leads to inability to walk, because when you have low oxygen, you can barely breathe, you can't really walk properly or straight. So those are the signs and symptoms. Okay, how to evaluate the disease, how to evaluate asthma. So, as you see here, skin test for allergic reactions. What you're going to look for is some signs of allergic reactions, conditions such as eczema or even hives. Another way to evaluate the disease is examine your nose, your throat, and even your upper airways. You can also use a stethoscope to listen to your breathing. So, what you're going to listen to is what? We spoke about this. Wheezing, 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 wheezing. High pitched whistling sounds when you breathe out. That is one of the main signs of asthma. Genetics of the disease. So, the genetics of asthma. So, a person is more likely to develop asthma if they have a family history of the condition. So it's basically like diabetes or hypertension. Once you have a family history of this condition, it is more common for that person to get asthma. This means that asthma is genetic. Some researchers even describe it as a highly heritable disease. So, however, genetics are not the only cause of asthma, as we all know. But genetics do play a huge role when it comes to asthma. But it is said that genetics play less of a role in asthma development later in life. So adult onset asthma is slightly less dependent on genes. So like I said, asthma is more common in children than in adults. You can kind of grow out of it in a way. Something can still trigger that asthma if you once had it, but it is not as likely. Here are a few of some expected outcomes. Expected outcomes is decreased respiratory distress, decreased work of breathing, improved air exchange, and decreased anxiety. So here are some nursing implications. So we're going to assess vital signs as needed while in distress. We're going to assess the level of anxiety, and we're also going to assess their breath sounds, the wheezing. We're going to monitor their arterial blood gases, and we're also going to administer short-acting beta-2 adrenergic agonists and inhaled corticosteroids, which is an anti-inflammatory drug for inflammation. Okay, so asthma and nutrition. Although there is no specific diet recommended for asthma, there are some food sources that can help support lung function. So we have vitamin D and vitamin E. Vitamin D helps boost the immune system and helps reduce airway inflammation. Food sources include salmon, milk, orange juice, and eggs. Vitamin E contains a chemical called tocopherol. Great. Which may decrease the risk of some asthma symptoms, such as wheezing and coughing. Some food sources that contain tocopherol are almonds, raw seeds, mustard greens, broccoli, and hazelnuts. Okay, we are still on asthma and nutrition, but for this slide, we're going to focus on what to avoid, which are sulfites and foods that cause gas. Sulfites are found in many dried fruits and can cause adverse reactions or even worsen the asthma symptoms. Sulfites are also found in shrimp, cherries, bottled lemons, and alcohol. It is most commonly said that red wine is what triggers asthma attacks. Foods that cause gas. So avoid foods that cause gas or bloating because it can often make breathing more difficult, which may cause chest tightness and trigger asthma flare ups. Food to avoid include beans, carbonated drinks, onions, fried foods, and garlic. This last slide is just a bibliography. We just hope that you learned something from this presentation about asthma. Just take it with you throughout life because you don't know if someone might have an asthma attack. You can teach them a lesson or two. Thank you for watching. Goodbye.